Do you get a burning pain on the outside of your thigh? If so, you may be experiencing a condition known as meralgia paresthetica. Now, I recently experienced this myself, and let me tell you, it's not fun. But fortunately, I did find one really excellent exercise that helped take care of the problem, and I wanted to share it with you. Now, additionally, I found a couple other tips that I'll also share. But before I get into those, I want to first explain what exactly causes meralgia paresthetica in the first place. Meralgia paresthetica is a nerve problem with the lateral femoral cutaneous nerve on the outside of your thigh. Lateral means outer, femoral means your femur or thigh bone, and cutaneous means your skin. So it's a sensory nerve. It doesn't supply muscles. Now, the lateral femoral cutaneous nerve comes from the L2 and L3 nerve roots in your spine. It passes down over the iliac crest and then through your pelvis by the iliopsoas or hip flexor muscles. It then runs under the inguinal ligament in your groin and passes by two muscles on the front of your hip known as the tensor fasciae lata and the sartorius. Now, that lateral femoral cutaneous nerve can get irritated anywhere along its path. For example, if you wear a tight belt, that can irritate it, or if you're in positions of prolonged hip flexion or repeated hip flexion, that can irritate it. Now, in my case, I did tend to notice it when I was sitting for long periods of time, for example, working at the computer. And I would notice it most if I was sitting at the computer not using back support, and I know better, but it's easy to get in the habit of typing like that, where the pelvis is tilted forwards, the lower back is arched, and the hip flexors are being used to hold yourself up. Now, as I was doing that, I just noticed that if I would lean back into the chair and externally rotate my hips or turn my knees out, it felt better. And so I kind of played around with that, and I discovered an exercise that worked really well to help relieve the pain. Now, I've never seen this exercise anywhere, but I played around with it. It worked really well for me, and so I wanted to share it with you. So you start out with your ankles crossed, and if this is the sore leg, you want that ankle crossed in front. Now, the reason for that is you can use this opposite ankle to help push on that other ankle, push it forwards a little bit, and that pushes you a little bit more into hip external rotation. Now you're going to scoot forwards on the chair and push the ankles back underneath the chair, or as much as you can. So you're scooting your bottom to the front edge of the chair, ankles are going backwards. Now you squeeze your bottom muscles to help externally rotate your hips and also extend your hips or push your pelvis forwards. Now that creates a hip flexor stretch of your iliopsoas muscles as well as of your tensor fasciae lata, which is a hip flexor and internal rotator. And I noticed that if I was sitting in positions of hip internal rotation, it would hurt worse. So externally rotate the hips, push the ankles back, scoot to the front of your chair, squeeze your glutes, so you strengthen your glutes while you're doing this, and you help externally rotate your hips. You use this ankle to help push the other one forwards a little bit more, and then just hold that position. Now you should feel a really good stretch kind of on the inner groin here. And just hold that for about a minute. I would tend to sit like this on and off throughout the day, and it would help relieve the pain quite a bit. Now additionally, when you are sitting, if this is the type of problem that's causing your meralgia paresthetica, it is a good idea not to sit in a forward position like this, because this uses your hip flexors, particularly the iliopsoas, but also your tensor fasciae lata as a postural muscle to help hold you up. So make sure you do sit back in the chair and use the backrest. And then it does help to kind of externally rotate your hips together, whether you just put your feet together or whether you actually kind of cross the ankles like that. Now, additionally, I did notice some issues when I was standing and walking as well. And that would particularly happen if I was putting weight on this foot and allowing the foot to pronate and the hip to internally rotate. So when I was walking on this leg, I would focus on hitting on the outer side of the foot and squeezing the glute of this leg So you would activate the hip external rotators, keep the weight out here using the gluteal muscles instead of using the tensor fasciae lata for support. And that helped relieve pain when I was standing and when I was walking as well. So hopefully if you are having meralgia paresthetica, you can try these exercises and they help you out. And if you do try these and they help, leave a comment below letting me know how they work for you. So that's all I have for today. If you found this video helpful, give it a like and make sure to subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.